mounting of that third wave, and many people criticizing government for the slow rollout of those vaccines. Well, our reporters are checking on the situation around the country for us. Heidi Giokos is in Kempton Park, Letiwe Mbluli is in Durban, and Nobasutu Hejana joining us from Cape Town. Let's tackle what's happening in Joburg first with Heidi Giokos. Heidi, a very good morning to you. Is it looking like week 2 for phase 2? Is it looking any better?
Rollout here in Gauteng increase. We do know that the private sector has been brought in for the likes of Dis-Chem, as well as Clicks being able to administer the vaccine, as well as Discovery increasing its sites. But of course there is much criticism with how slow the vaccine rollout process has been unfolding in the province, also given the fact that we are in a third wave. We are joined by the provincial spokesperson for the province, Thabo Masebe. Thanks so much, Mr. Masebe, for your time. We appreciate it. I think first off, let's just start with how you think the province fared in terms of its first week of phase 1B and phase 2 of the vaccine rollout.
Well, we think the first week went very well. Obviously, it was the start of the vaccination program, so we did anticipate that it will be a rather slow start. But we're happy with the number of people who came forward to get their vaccines. This week, obviously, as you said, we will be ramping up the numbers. More vaccination sites will be open from both the public and private sector. And we would like to urge more people who fall within the age category of the groups that are going to be vaccinated to register so that they can be vaccinated. We are also going to be increasing our outreach work through various platforms, the hotline and many other activities that we're going to be doing to reach out to those who are 60 years and older to ensure that they do register so that they can get vaccinated.
Just speak to us about the vaccination sites that have increased in the province. We know there was a document that was sent out on Friday to say more vaccination sites will be across the province, but we don't have details of that, and I'm sure many watching would want to know where they can go to get their vaccine with the increased vaccination sites. Can you give us those details?
Like we did with the vaccination sites that were opened last week, we will be publishing the new sites that are open from this week from both the public and the private sector. That will be available on the government website and all the social media networks.
So you're not sure of the exact number of vaccination sites?
I will not be able to give the exact number now because the sites are being made operational as I'm speaking now. So at the end of the day, we'll be able to give the full details of where exactly those places are. But obviously, we're going to make sure that the vaccination sites are spread across all the 5 regions of the province, Tshwane, West Rand, Johannesburg, Ekurhuleni, and Sidibeng. We'll make sure that there's enough sites so that the people in those specific areas do not have to struggle to find where their vaccination sites are.
Mr. Masebe, could you maybe give us an indication of how many have been vaccinated in the province under phase 1B? We do know that when National sends out its statistics, they only give an indication of Sisonke and phase 2. Nobody knows how many healthcare workers and support staff have been vaccinated under phase 1B in the province.
No, by the end of last week, we had about just over 30,000 vaccinations since the start of the week. And we expect that number to go up in a big way this week. We intend to use all the vaccine the vaccine doses that we'll receive, so that as soon as we use them up, we can then approach the national government to give us more.
Okay, and just give us clarity with regards to those who do not have vouchers issued by the EVDS system. Can they go into certain vaccination sites as walk-ins to get the vaccine? We know certain sites have not been taking those who have actually registered and have a clear voucher and appointment dates because they've been able to take walk-ins, and then they don't have capacity to take everybody in. What is the issue around that? Can walk-ins be accommodated, or is it strictly just vouchers at all vaccination sites in the province?
Obviously, the EVDS was established to help us manage the vaccination program, but we will not turn anybody away from the sites as long as they are registered, or there will be people at the vaccination sites who will be able to assist people with all that work of registration. The aim is to ensure that the people within the age category that is being vaccinated now do get vaccinated. So as government, we want to do everything to make it possible that those who are 60 years and older do get vaccinated. So we will publish the vaccination sites, but we'll also continue to call them, and we'll also encourage them to call the hotline so that they can establish when is their time to get vaccinated.
Are you seeing a reluctance from those in phase 2, the senior citizens and elderly, not wanting to get the vaccine?
Actually, a lot of people are saying they want to get vaccinated. We speak to them and they say, we are just waiting for the SMS to indicate when and where can we be vaccinated. And our call to them is that do call, don't wait for the SMS only. You can also call so that you establish where is your vaccination site, and you can go to your vaccination site and get assisted.
Okay, and then just lastly, Mr. Masebe, we know that the province is currently in its third wave. Numbers are increasing and alarming within the province. There's been much criticism that the communication from the Gauteng province has been extremely poor with regards to the vaccine rollout, and that the process of the vaccine rollout is not where it should be. As a province, what do you have to say to this criticism and many concerned citizens that are trying to get vaccinated but have no idea what to do or how to get to a vaccination site?
Well, the vaccination rollout program started last week. And as it started, we published all the vaccination sites. And as I said to you now, we're going to publish more vaccination sites, which will be opening from this week. And we continue. There's a hotline where people can call. People can also call the number or contact the EVDS. We remain open. We continue with our efforts to reach out to the people who are 60 years and older to ensure that they are made aware of what they need to do to get vaccinated. Our aim, of course, is to get people vaccinated. Of course, vaccination is a voluntary matter, so nobody is forced, but we really do appeal to all those that are 60 years and older to get vaccination, because the vaccines do save lives and they do prevent serious illnesses in the event one is infected with the coronavirus.
We've run out of time, but I just have to ask you this again. Do you think that your efforts in communication in the province have been satisfactory, given that the province is in its third wave and the vaccine is so crucial at this time?
Communication can never be enough. As I said, we've only started the program last week, and we continue to communicate as we ramp up the numbers of vaccination sites. We continue to reach out to the actual people who need to be vaccinated so that they know what action they need to take to ensure that they do get vaccinated. So that work continues. We will never stop communicating. It's an ongoing process. We will continue to communicate until all the people who have to be vaccinated are vaccinated, and even thereafter we'll continue to talk about the importance of protecting ourselves, looking after ourselves, practicing all the non-pharmaceutical measures to ensure that the virus does not spread to more people.
Okay, great. Thanks so much for your time, Mr. Masebe. That's the provincial spokesperson. Yuveka, back to you.
All right, thanks very much, Hadi Giokos. We'll continue